Hi, my name is Michelle Hidalgo. Today I'm going to talk about effects of aspirin for primary prevention in patients with diabetes mellitus. First, the definition. Diabetes mellitus is associated with an increased risk of cardiovascular events. Aspirin use reduces the risk of occlusive vascular events but increases the risk of bleeding. The balance of benefits and hazard for the prevention of first cardiovascular events in patients with diabetes is unclear.
In people with pre-existing cardiovascular disease, aspirin use is associated with overall benefit. Patients with diabetes mellitus are at increased risk of cardiovascular events, but the benefits and risks of aspirin as primary prevention in patients with diabetes are unclear. In this multicenter randomized double-blind placebo-controlled trial, 15,480 adults with diabetes but no evidence of cardiovascular disease were randomized to receive 100 milligrams of aspirin or placebo daily. The primary efficacy outcome was the first serious vascular event, defined as a composite of non-fatal myocardial infarction, non-fatal stroke or TIA, and vascular death. The primary safety outcome was the first occurrence of any major bleeding. After a mean follow-up of 7.4 years, the primary efficacy outcome had occurred in significantly fewer patients in the aspirin group than in the placebo group. However, aspirin use was associated with significantly higher rates of major bleeding. The majority of bleeds were gastrointestinal and extracranial.
Application in medicine. We randomly assign adults who had diabetes but no evident cardiovascular disease to receive aspirin at a dose of 100 milligrams daily or matching placebo. The primary efficacy outcome was the first serious vascular event. When we talk about pros and cons, pros, aspirin reduces the risk of cardiovascular problems in people who have already suffered them. And cons, gastrointestinal bleeding, liver disease clinical active, stroke caused by a blood vessel buster.
I think this is a very difficult question in a way because we have to really try to estimate the risk of patients with diabetes. As far as we know, the guidelines, practice guidelines are very controversial on this issue.
When we talk about the issue applied in Ecuador, diabetes is affecting the population with increasing rates. According to the Ansonet survey, the prevalence of diabetes in the population aged to 10 to 59 years is 1.7%. That proportion goes up from 30 years of age, and 51 in 10 Ecuadorians already have diabetes. Now the conclusion. Aspirin use prevented serious vascular events in persons who had diabetes and no evident cardiovascular disease, a trial entry, but it also caused major bleeding events. The absolute benefits were largely counterbalanced by the bleeding hazard.
Cyclooxygenase 1 plays a role in platelet function. Aspirin interaction with platelet COX-1 receptors mediates the cardioprotective benefits of aspirin therapy. In patients on such therapy, ibuprofen may compete with aspirin to occupy platelet COX-1 receptors, potentially compromising aspirin's cardioprotective benefits.
Thank you so much.